Good afternoon, everyone. In March, this country took an historic step to improve quality and access to the healthcare system with the enactment of the Affordable Care Act. Since then, we've worked diligently with our partners to get the benefits to the American people as quickly as possible. And today, we're just 6 weeks after the law was signed, and Americans already have more control over their health care. Small business owners can hire more workers thanks to the tax credit that helps them pay for health insurance. Americans who have been unable to get insurance because of their pre-existing conditions can look forward to high-risk insurance pools, and we're working with states to set those up within the next 2 months. And by shining a bright light on insurance companies, we've been able to encourage insurers to implement 2 very important new benefits that weren't supposed to take effect until September. And they're going to happen right away, allowing young adults to stay on their parents' insurance until they turn 26, and ending the practice of canceling people's coverage when they get sick and need it the most. Thanks to these reforms, we can already see a more consumer-friendly insurance market taking shape. But Americans won't reap the full benefits of this reform unless we also work simultaneously to improve the performance of our healthcare system. And that will be hard to do if the medical system continues to rely on pencil and paper. And that's why the Recovery Act included an historic investment in health information technology. Dr. David Blumenthal, our national coordinator for health information technology, is with us today, and I want to personally thank Dr. Blumenthal for his incredible leadership. David has often said that if information is the lifeblood of our healthcare system, then health IT is its circulatory system. Every healthcare decision depends on the availability of accurate and up-to-date health information, and the absence of that information can make it hard for health providers to do their jobs. For example, it's hard for hospitals to provide information about medical outcomes if they don't have an automated way of tracking them. It's hard for a team of doctors to coordinate care if there are so many different charts. And the evidence for electronic health records is very clear. It cuts paperwork, lets doctors concentrate on what they do best, caring for patients. Health IT provides the connection that enables all of the providers on a patient's team to coordinate medical care, which we know is the key to better outcomes. It enables us to collect data on treatment and outcomes so that we can measure results, which is an important step to improving quality. And by allowing the folks on the receiving end of care to have access to their own medical records, Health IT empowers patients to be partners in the best care possible. We know Health IT improves care. Yesterday, in a peer-reviewed study published in the respected journal Pediatrics, a nationally known children's hospital reported that electronic health records were associated with a dramatic 20% reduction in patient deaths. The Lucile Packard Children's Hospital, which takes care of some of the sickest children in America, estimated that 36 children were alive today after the introduction of electronic health records who might not have survived absent those health records. I recently visited the Cincinnati Children's Hospital, which told me much the same thing. According to the staff in that hospital, since they installed the electronics record system, they've gone 1,000 days without any safety incident. But for me, the most convincing arguments come from the doctors themselves. In system after system, where they use well-designed electronic health records, doctors tell me they're much better physicians than they were before, and they never go back to the old system. But despite this enthusiasm, just 10% of our nation's hospitals and 20% of physicians' practices have adopted even basic electronic records so far. Now, there's some good reasons for those barriers. Electronic health records can take time to get used to. Need to make sure that the provider down the road is using a similar system and your system can talk back and forth. If Health IT grows, we'll need more skilled healthcare workers to respond. But the Recovery Act addresses each of these concerns. It creates Health IT region extension centers where providers can go for technical support, whether it's a health record system to fit their needs or how to get the most out of one once it's installed. The Recovery Act provided the funding to help states make sure that health information can securely be exchanged across providers and with hospitals. It sets funds aside to help train the health IT workforce of the future. It includes financial incentives for doctors and hospitals to adopt records and use them to deliver better care. The grants the Vice President is about to announce will go to communities that show great potential for using health information technology to improve health outcomes. We expect the communities with the winning proposals to show the providers throughout the rest of the country how health IT can improve the health and care of the patients they serve. With these new grants, we're closer to the day when every patient and every provider can electronically share accurate, private, and secure health data, to the day when health IT is a growing industry that creates thousands of jobs across the country. Our goal is to spark a transformation of care for all Americans with full protection on patient privacy. Electronic health records give providers the ability to make informed decisions about patient care and enables patients to take control of their own health. In other businesses where information technology has taken over, banks, grocery stores, on your cell phone, you couldn't imagine doing without it. Every other sector of our economy has taken advantage of information technology to improve the way business is done and improve the ability to get real results. And we're going to work very hard to make sure that the healthcare system does just that. Now, the Vice President of the United States has been an enthusiastic supporter of the Recovery Act investments, understanding how these resources are transforming the American economy. He's been a great leader working with me and my colleagues to maximize the benefits of the historic resources and has some exciting announcement about Beacon Communities. Mr. Vice President.
Thank you, Madam Secretary. Appreciate it very, very much. I want to welcome three of my former colleagues here today. Senator Sheldon Whitehouse of Rhode Island is here, and Representative Paul Konjorsky, who lives almost in heaven. He's close to Scranton from the Northeast, and Representative Tim Waltz from Minnesota. Welcome to all of you, and thank you for being speaking of enthusiastic supporters, great supporters of this initiative. You know, when the President signed in the law the Recovery Act, we had two main goals. The first goal was to create jobs amid the worst recession since the Great Depression, and the second was to build a stronger economic foundation for long-term growth. And that's what I want to talk a little bit about today. It's just not the impact on the healthcare system, but it's going to build a stronger foundation. You see, with health IT, or electronic medical records, and I might add today in the statewide paper in my home state, I was home last night for dedication of a hospice dedicated a place to my mom, and I went home and this morning's paper, you can't see this very well, but there's a bunch of paper files and file after file after file. And it says underneath it, it says, St. Francis Hospital family practice clerk Linda McAlore works with the paper filing system, which includes thousands of handwritten files on Friday. The practice is one of the many making the change in electronic filing. It says, guiding Delaware's doctors into a paperless world. Well, you know, I know firsthand from being a significant consumer of healthcare, unfortunately, and my family, that this is also, which I'll speak to in a moment, one of the ways in which, as the Secretary spoke to, we can also save a whole lot of lives in the process here. But these electronic records are not, we're not just creating jobs, we're creating whole new industries here, industries that will shape the 21st century economy for generations to come. That's why we're using this $2 billion in upfront Recovery Act funding, along with billions to follow, to further the use of technology in improving our healthcare system, setting a clear goal to make sure that every person every person has access to electronic medical records by the year 2014. You know, today we're here to talk about one specific program, Beacon Communities, in which we'll be awarding $220 million to 15 communities across the country to harness the full power of the electronic medical records to improve care and to cut costs, so that from the perspective of the layman like me, you know, what does health IT mean for the average American? I mean, when we talked about this, and we have been talking about this for now 4 or 5 years, longer since the RAND study came out. I don't know how long ago that was. And people don't quite understand what it means. Well, it means instead of telling every doctor that you go to see your medical history, I just am be grateful not having to fill out that form, you know, in the office. And sometimes when you go back a year later, filling it out again, it would just be a wonderful thing. But, you know, your medical history, the different prescriptions you're on, what tests you've had, what you're allergic to, your doctor will be studying that information as you walk into his or her office. They'll have it in front of them. Instead of the senior I met, not long ago, waiting 2 hours while a specialist tracked down her charts. Her records are going to be able to be pulled instantly, and she's going to know the doctor know exactly what's going on. It means that in life or death situations, a doctor in an emergency room knows right away that the patient has a history of an irregular heartbeat or an allergy to a specific medicine, so the doc can respond accordingly. Recently, a colleague of ours, Sheldon, Tom Carper, his driver, a young man, had a driving Tom and said he had something was wrong. He just had an irregular heartbeat. And they went right to the emergency room, and they almost gave him. It turns out he had a record, but they almost gave him the wrong treatment. Fortunately, the kid was alert and knew enough to tell them what his circumstance was. So, look, let me tell you what it means to be part of the Beacon Hill Community Program. These 15 communities are going to improve care and reduce costs. They will be able to, hire health IT experts, physician practice consultants, healthcare managers, and the frontline office staff and clinical workers. Secondly, they're going to be able to purchase the technology and develop the software necessary to connect all the systems that they use. Help patients with chronic diseases keep their medical appointments, take their medications on time, make sure their providers, their specialists and hospitals are all connected. Now, they're going to be able to purchase telehealth and telemonitoring equipment for patients in rural areas, including electronic blood pressure cuffs and instruments to measure blood glucose, video monitors, and telephone equipment. This has the potential to revolutionize the way medicine is distributed, especially in rural areas. In Tulsa, Oklahoma, not a rural area, it can help make more diabetic patients keep their blood sugar levels under control while reducing duplicate lab tests, reducing the number of referrals to specialty care, and reducing the number of hospitalizations, saving nearly $11 million a year. It means in Eastern Maine they can improve diabetic care, improve cardiovascular care, and improve asthma care, all while reducing preventable emergency room visits and reducing hospital admissions. In fact, in the Eastern Medical Healthcare System has committed to reduce by 15% avoidable emergency room visits. That would mean a reduction of approximately 7,000 visits at a total cost saving of $2.1 million per year. Imagine that replicated throughout the nation. It's a big number. It's a big deal. And these awards aren't going to be working alone. They're going to work with other health IT and recovery funds that are going to these communities. Take Maine, for example. Beacon Community Funds will work in concert with almost $5 million in funds that Maine received to train providers through a healthcare IT extension center program. You know, you have agriculture extension. You know, it sounds kind of silly, doesn't it? And I hope the docs in the audience aren't offended. But, you know, we have agriculture extension, big deal in my state. It revolutionized the way farming takes place. You have these experts available to come. Well, you know, it's the same generic principle here. Almost $700,000 in health IT workforce grants to community colleges in Maine to train approximately 100 students a year. 8 community health care centers that will, A, create and support additional locations that patients can go to get care, expand access to treatment and services that patients may not have been able to access before, improve the infrastructure at already existing facilities, which could include anything from fixing the heating and cooling systems to building new patients' rooms. Two Recovery Act broadband grants in this region, totaling $27.2 million, and an FCC rural healthcare pilot project. Together, and this is, I'm giving you an example of one community, but this is happening all across America. Together, these will build out an infrastructure that's going to not only allow doctors and hospitals, but also homes, small businesses, and other institutions to move quickly and securely transfer information, anything from patients' records to x-ray information to electronic prescriptioning. And so this all by using the internet, all critical to making our healthcare system more efficient. Now, I might add, one of the things that Kathleen and I talked about very briefly was, we believe there's a lot more savings in the healthcare bill that we passed. As my colleagues in the Congress know, you weren't able to score these things. The OMB is very meticulous, as is the Congressional Budget Office. I try to forget them because
You did a good job.
because Kathleen said I did a good job forgetting them, but CBO, you know, they only count what they can feel and taste. They only count what's done before. And so we think there's a lot of additional savings to be had. Instead of just saving $1.3 billion the next 10 years and $1 trillion over the second decade, we think that number will be significantly bigger after 2014, when we have this everyone in on the deal here in terms of electronic records. You see, folks, the Recovery Act is not just about a series of individual programs that work independently. It's about a cohesive plan with many pieces to it, and they all fit together to accomplish a bigger goal. It's about building a healthcare system for the future. And look, but beyond all that, you know what else it means to these communities? It's going to mean jobs. By the way, if it didn't even create another job, it's worth its weight in gold just to get it done, for improving the health and saving billions of dollars over time. But it means jobs. Innovative jobs in high-tech fields, jobs that America needs to bring our healthcare system up to the level Americans deserve. And together, these 15 communities will create more than 1,000 jobs with an average salary of $70,000 a year. That's welcome news to those communities. These are good jobs, jobs you can raise a family on. Managers, technical experts, IT consultants, data analysis, nurse practitioners, case managers, and administrative staff. Jobs in a field that isn't fading away. In fact, the field is growing. I might point out, during this recession, the only field that continued to increase employment was the healthcare field. In all parts of the Recovery Act's historic $100 billion of innovative funding, from the smart grid to high-speed rail lines, fuel-efficient vehicles, research and development, renewable energy production, and yes, health IT. All of it is setting America up to be better able to compete and to lead the world in the 21st century. All of it is providing jobs today and building an economy for tomorrow. So this is a win-win-win. People's health will improve, safety will improve, efficiency will be had, billions of dollars in savings over time, and significant job production in areas that are not exportable, and you can make a decent living providing a good service to the American people. So I thank all of you for being here today. I particularly thank the Secretary for her leadership, and David, thank you, man, for being willing to come out of the, or into the cold, I guess, from the private sector to come in here and help us manage this. So thank you all very, very much, and may God bless you all, and may God protect our troops. Thanks a million.